Welcome to Prudent Psychology 101. So today in this video session, we'll be going through behavioral therapy, cognitive behavior therapy, and approaches to counseling. This is very brief introduction. So introduction to behavioral therapy and cognitive behavioral therapy. So what is the definition of behavioral therapy? Behavioral therapy is an umbrella term for types of therapy that treat mental health disorders. This form of therapy seeks to identify and help change potentially self-destructive or unhealthy behaviors. It functions on the idea that all behaviors are learned and that unhealthy behaviors can be changed. So this is a very brief introduction. So I'll tell you about the history of behavioral therapy. In earlier 20th century, behavioral psychology or behaviorism arose in the early 20th century in reaction to the method of introspection that dominated psychology at that time. John B. Watson, the father of behaviorism, had initially studied animal psychology in the 1960s. Behavior approaches emerged as a dramatic departure from the assumptions and methods that characterized psychoanalytic and humanistic therapies. However, in 1960, behavior therapy emerged as a systematic and comprehensive approach to psychiatric behavioral disorders. Joseph Wolpe and his colleagues used Pavlovian techniques to produce and eliminate neurosis in cats. From this research, Wolpe developed systematic desensitization. At about the same time, Eysenck and Shapiro stressed the importance of an experimental approach in understanding and treating individual patients using modern learning theory. A Harvard psychologist, B.F. Skinner, also inspired the origin of behavior therapy. So what are the techniques used in behavioral therapy? Basically, behavior therapy were used to cure various phobias. Well, they used the technique called systematic desensitization, and this consists of 3 steps: counter conditioning, graduated exposure, participant modeling. I'll briefly explain what exactly this is. Counter conditioning is Wolpe taught his patients relaxation techniques like controlling breathing. Larry Ventus used humor therapy as a type of counter conditioning. This involves pairing the object, activity, or creature that produces the fear response. And what is graduated exposure? The therapist and the patient work out a stimulation hierarchy, a list of encounters with the feared thing, going from the least intense to the most intense. What is participant modeling? With really severe phobias, the patient can't even bear to watch someone else encounter the fear object. In this case, Richard Sharf 2000 recommends covert modeling. This is where the first step on the stimulation hierarchy is to imagine someone else encountering the feared object. So I'll give you an example of hierarchy of anxiety arousing scenes, like how it starts: hearing about someone else who has a test, instructor announcing that a test will be given in 3 weeks, instructor reminding class that there will be a test in 2 weeks, overhearing classmates talk about studying for the test which will occur in 1 week, instructor reminding class of what it will be tested on in 2 days, or leaving the class the day before exam, studying the night before the test, getting up morning of the test, walking toward building where the exam will be given, walking into the exam room, instructor walking into the room with the test being distributed, reading the test questions. So like this all provokes or arouses anxiety. So this is called the hierarchy construction of anxiety building or phobias or whatever it is. And in relaxation training, what they do is can help control their physiological responses in stressful situations. So a variety of relaxation methods have been developed. So most methods use progressive relaxation, also known as somatic relaxation training, developed by the psychiatrist Edmund Jacobson. And if I like how to practice deep breathing. The key to deep breathing is to breathe deeply from the abdomen, getting as much fresh air as possible in your lungs. Sit comfortably with your back straight. Put on one hand on your chest and other on your stomach. Something like that, the meditation techniques. Progressive music relaxation for stress relief. Listening to music. It involves two-step process in which you systematically tense and relax different muscles groups in the body. Muscle relaxation, right foot, right calf, left calf, etc. And loosening your clothing, this all can help. Step 3 would be desensitization of the anxiety-provoking stimulus. In the final step called desensitization, the patient proceeds systematically through the list from the least to the most anxiety-provoking scene while in a deeply relaxed state. In fact, they vividly imagine the situation as is given in the list, and as they imagine and as they are in relaxed state, the scene, even if evokes anxiety, the anxiety does not bother the individual. So these kind of practical experimentation experiences were given to the patient. So now we will move on to CBT. Do study about aversion therapy. I will probably cover it in my next video. Now let's go to cognitive behavior therapy. So a brief introduction. Cognitive behavioral therapy, or CBT as popularly called as, is a short-term therapy technique that can help people find new ways to behave by changing their thought patterns. Engaging with CBT can help people reduce stress, cope with complicated relationships, deal with grief, and face many other common life challenges. So what is the brief history of CBT? CBT is a form of psychotherapy that emphasizes the important role of thinking in how we feel and what we do. Albert Ellis systems, originated in the early 1950s, developed rational emotive therapy, RET, the first discrete therapeutic approach to CBT. Aaron T. Beck, inspired by Albert Ellis, developed cognitive therapy in the 1960s. Ellis developed and popularized the ABC model of emotions and later modified the model to the ABCDE approach. In the 1960s, Ellis renamed his approach Rational Emotive Therapy, Behavior Therapy. Behavioral therapy focuses on a person's actions and aims to change unhealthy behavior patterns. So on the right side you can see an image which says event, cognitive appraisal, then emotion, then behavior, then event. So sometimes from behavior we go back to cognitive appraisal and then come back to emotion, and sometimes from emotion itself we go back to cognitive appraisal. So this is the brief history of CBT. Some of the techniques that are most often used with CBT include the following 9 strategies. So the headings can be different, but these are the 9 techniques that I have mentioned. Cognitive restructuring, first step. Exposure therapy, guided discovery, journaling and thought records, behavioral experiments, activity scheduling and behavior activation, relaxation and stress reduction techniques, role-playing successive approximation. I'll very briefly explain to you what these are. So, cognitive restructuring or reframing, this involves taking a hard look at negative thought patterns. So, we all carry a lot of negative thought patterns, and because of that, the consequences are also not pleasant or good in life. If we want to change our life, we have to change our thought patterns. So, the first thing is to take a hard look at negative thought patterns. Guided discovery. The therapist will acquaint themselves with your viewpoint, then they will ask questions designed to challenge your beliefs and broaden your thinking. Sometimes what happens is we are stuck in a pattern of thinking and we refuse to come out of that. So the therapist will challenge your beliefs. Exposure therapy can be also to confront fears and phobias. In case you have any fears or phobias, that was a consequence or because of all this negative thoughts, then you will be exposed. This therapy will expose and confront those fears and phobias. Journaling and thought records. Writing is a time-honored way of getting in touch with your own thoughts. Sometimes in a loop we keep on thinking thoughts. When we write it down, it makes a lot of difference. Activity scheduling and behavior activation can help establish good habits and provide ample opportunity to put what you have learned into practice. So the next step is behavior experiments are typically used for anxiety disorders that involve catastrophic thinking. Some people are beyond correction. They become incorrigible. So next is relaxation and stress reduction techniques. As I told you, meditation, taking deep breaths, relaxing your muscles, all those stuff. Then role playing can help you work through different behaviors in potentially difficult situations. Playing out possible scenarios can lessen fear and can be used for various activities. Successive approximation. This involves taking tasks that seem overwhelming and breaking them into smaller, more achievable steps. If you have a big event coming up and you have less number of days to complete all the preparation work, then you can become overwhelmed by the task in hands. So what you can do is take step by step, break it down, delegate the work and things like that. Once you break down the work, then it becomes easier to delegate or to accomplish it. So these are the techniques, and thank you for watching this video. I hope this was helpful, and this was a brief introduction about behavior therapy and CBT and the different approaches to counseling. Well, thank you so much. See you in my next video session. Bye. Yeah, please do subscribe and do like this video and comment below in case you have any request or you have any suggestion. Please do give your feedbacks. Thank you so much.